Ladies, I am so excited for today's podcast. Joining me on the podcast is Dr. Lindsey Berkson. She is a hormone scholar. She breaks down complex science and makes it very easy to understand. In our discussion today, we will be discussing why women need hormones, the difference between birth control pills and hormone replacement therapy and how they are not the same. We will be talking about the role of testosterone to get us started. We pivot into estrogen and then why most women need progesterone, even if you don't have a uterus. And then we end with how long women should be taking hormonal therapy. I hope you will enjoy this amazing discussion with Dr. Lindsey Berkson. Now, let me formally introduce her. She was a distinguished hormone scholar at the Center for Bioenvironmental Research at Tulane and Xavier Universities. She is a leading figure in integrative medicine, renowned for her expertise in hormones, nutrition, digestion, and environmental science. With a background as a clinician, a professor, a best-selling author, and a radio show host, she brings a wealth of experience to her work. Dr. Berkson is a respected educator, teaching doctors and pharmacists in advanced certification courses. She has developed innovative nutraceuticals, holds patents, and bioidentical hormone replacement therapy, and has contributed to groundbreaking research on dialysis, pharmaceutical medications, and nutrition. Dr. Lindsey Berkson consults internationally, focused on medical nutrition for breast cancer, inflammatory bowel disease, renal problems, and complex health issues. Ladies, I know you're going to find this information very helpful, informative, and hopefully elevate your knowledge about hormone replacement therapy. Please enjoy. Dr. Lindsey Berkson, thank you so much for coming on my podcast. I have been thinking about inviting you for a long time, and I'm glad we were able to schedule this because let me just start off by saying I have learned so much about my hormonal health, the inaccuracies and misconceptions about hormones out there, and I was appalled. As a pharmacist, I thought I had the latest and greatest knowledge, and here I was still with outdated information. So by reading your Substacks, following you on all the platforms, I have really empowered myself. You are a hormone scholar for sure. And so I really want you to come on this podcast and really educate the women out there really about what the latest is around hormones. I know myself, I was following outdated information, and by going on bioidentical hormones, thanks to you and others, it has changed my life. It has changed how I feel. It's changed how I show up. So I want to start the conversation off, if we can, with looking at why do women need hormones?
Okay, well, first of all, I want to thank you for creating this space where we can have agile conversations that your audience can listen to and get enough solid sense to feel more safe inside. And, when I was younger and the health revolution was occurring, we were excited about achieving our health. We learned that our body was a temple and we could achieve health. And we were looking forward to understanding what do we need to do, body, mind, and spirit, to get that health. But today, our relationship with our health is so different. We don't even know what it feels like to have extreme well-being or well-being intelligence. We're mostly run by fear, and our sense of health is constantly getting tested for what we don't have, monitored so we don't get those cancers, and not quite sure, but we know we don't feel good from body, mind, and spirit, north to the south. So it's so great to be able to have these conversations. And the reason women might consider hormones is that hormones are misunderstood. It's kind of like the history of mankind. There's so often where the main pearl of understanding is misunderstood, and the cultural consciousness doesn't yet get it. But hormones rule the show in the body. They are the most powerful signaling molecules anywhere in the body. They rule your brain, your eyeballs, your kidney function, your heart, your digestive tract, your muscle mass, your sense of wellness or your loss of wellness. They rule that, but because they have satellite dishes that pick up the emails that deliver all those protective signals to cells, all over the body when medicine got separated into these separate genres. There's gastrointestinal medicine and gerontologic medicine and renal medicine. They didn't take with them hormones. It's not part of kidney health or heart health or brain health. It's only thought to be kind of about sexy and reproductive things. I heard last weekend was A4M, one of the largest and great anti-aging facilities where providers become certified in functional medicine. There were 7,000 people there. And I heard that the main speaker talking about testosterone mainly spoke about its use in sexual things. And she was trying to get them to really ask the patient about sexual intimate questions when actually testosterone rules the gut. It rules the immune system in the gut. It helps the gut identify what comes in from outside. Is it friend or foe? Testosterone helps with that. That's why men get much less autoimmune diseases because they mostly start in the gut and testosterone protects the gut. And people are worried about Alzheimer's disease. And the people with the ApoE4 polymorphism, a glitch in this ApoE4 platform, those people are more vulnerable. But testosterone, if kept with replacement, even as we age in a normal to higher level, it shuts up that vulnerability gene. So testosterone protects your brain. I wrote about this in depth in my book, Sexy Brain. So the bottom line is hormones rule what goes on in your body. And when they're low, those tissues don't do so great. And it's a big part of staying and achieving really well-being IQ, where you actually feel like you get up and all of your molecules, it's a different universe. You've got a lot of energy and congruency, and you feel great to meet the day. Hormones have so much to do with that. So one, regular medicine doesn't recognize it or translate that into practice, let alone OBGYN or neurology, but talking into the other genres of medicine. And two, most of us are going to live longer now, and they really slow down the Mack truck of aging. And actually, three, because of the wrong interpretation initially of the Women's Health Initiative in July of 2002, medical schools, osteopathic schools, naturopathic schools stopped teaching hormone medicine. So when you ask one of your doctors, am I a candidate for hormone replacement, you're most likely going to get the wrong answer. So hormones rule everything, and they really help protect you against a lot of the used to be considered inevitabilities and frailties of aging. They can slow those down. But most providers don't respect that or know what to do about that. And so here's women kind of parting the curtain on hormones. But what's the truth, and who do you go to really even get it going in your own life?
Yeah. And I love that you brought up that 2002 trial that came out, the Women's Health Initiative. And that's essentially where I stopped learning about hormones, right? I bought into what was prophesized at the time about the increased risk of DVTs and clots and potentially cancer. Um, can you educate us about what has been the fallout from that and what's like the latest information now that we know more from that study?
It's really crazy if you look at it in depth. So hormone replacement began in England around the 1950s or 60s, and fast forward to the later 1990s, 18 to 20 million American women were on estrogen. And the promise of it from a gynecologist who wrote a best-selling book was that you would be feminine forever. It would keep you younger longer, but it was also used medicinally. Women were recommended to have it after a heart attack, after a stroke, after stents were put in. This was how hormones were originally recommended. And then we know we're an aging country and we don't want to topple Medicare. So we began this whole series of look-sees into women called the Women's Health Initiative. And it was put together by 40 institutions, prestigious, including the NIH and Harvard and everything. They're going to look at women every which way. So we'll keep you healthier. So we won't run out of money trying to pay for your medical bills. So they set up a, the really what they consider to be the seminal randomized trials. And we really have to stop being so mesmerized with randomized trials, but that's a whole nother conversation. And they thought they were going to prove that hormones did all those things, kept you younger and were good after even acute events like a heart attack. And they had two groups, one on women on oral conjugated equine estrogen, which is estrogen from a pregnant horse, and it's called Premarin. And the other product was very popular at the time. It was a combo product of Premarin and a synthetic progestin that was the real star of the show of progesterones at that time in the United States, called medroxyprogesterone acetate. And that together product, a combo product of a horse oral estrogen and a synthetic progestin, was called Prempro. And it was one of the best sellers of all the hormones in the United States at the time. But always in Europe, they pretty much used bioidentical hormones over there. It was different. So we started to do this randomized trial. And then for a lot of reasons, they were prematurely stopped, thinking that they actually caused the issues that the trials were very sure they were going to show protected. But in a very short period of time, they started to find all kinds of methodologic issues with the trial. And remember that also these were synthetic hormones, and it's really synthetic progestins that have been consistently linked to an increased risk of breast cancer. That's what is in oral birth control pills. And so within a few months, people of real great stature, so Leon Spiroff, who's like the father of gynecology, he's written the textbook everybody's weaned on. He started writing articles, "Don't throw the hormone baby out with the bathwater. We see clinically women do great." And in Europe, they went, "Why is America so reactive? You have two little randomized trials for the very first time, and everybody throws up their arms. Women started suing and getting successfully sued. Merck got successfully sued. So that's what happened is we're litigious like no other country. People got sued. We stopped teaching about hormones in med schools, all really based on these two studies, which within 2, 3 years, there started to be reanalyses. Steve Naftalin, the statistician from Yale, and a lot of different people began to say, this doesn't make sense. And if you look at the estrogen only, in the beginning, it looked like there was protection, and then it became statistical. And over almost 15 reanalyses of that study, it's been clearly shown that estrogen, who's gotten a bad name from all of this, that estrogen in healthy women protects against the risk of getting breast cancer. If you do get breast cancer, you have less risk of dying. And if you do have breast cancer, you have less risk of recurrence. So actually, it's bizarre that doctors got sued because a patient got prescribed hormones and got breast cancer in a year and a half. Now we're understanding that patient was better off. She most likely had a better player of cancer. She most likely is not going to die of that cancer. And it's the same for men with testosterone. But it was this new emergent idea that estrogen actually protects, is protective on many levels, and even breast cancer. So there have been many reevaluations that somehow never made the first splash of fear, because we use fear to sell medicine in the United States. And the good news was elbowed out by the bad, scary news. But there have been many of us in the wild trying to raise our voices to get women not to be denied the hormones that are the most powerful signaling molecules. They run the internet of your system. And when you have less hormone, you have email freeze. And everybody knows you can't do anything when you've got email freeze. Well, we were batting our head against the wall and lecturing and trying to say hormones are good and bioidenticals better. And there's actually a fair amount of building data to prove that. But the real kicker was what was published this last spring. And it put hormones back on the map in the United States. And it's the menopause study of women 65 and older. It was published in the journal Menopause in May of 2024. And it was sponsored by our NIH and our National Library of Medicine. And they looked at 10 million American women. They're on Medicare, they're 65 and older. We've got all their medical records. We're going to track how every woman took a hormone, estrogen and progesterone, how she got it into her body, and her outcome compared to the women who didn't take hormones. They did this huge data drudge, and they found out this is 10 million women with, they have the insurance records, and they have meticulous evaluation of life, death, adverse events like heart attack and who lived longest. And what that 10 million study from our NIH and National Library of Medicine showed is that women on hormone replacement live 19% longer. They have statistically less of 3 cancers. Breast cancer, you have less breast cancer when you're on estrogen, as long as you don't have excessive, and take synthetic progestins added to it. And there's caveats of what was better and what wasn't, and lung cancer and colorectal cancer. And then there was a trend of protection against several other cancers, because when they first published in preprint, before peer review had evaluated it on 7 million, they said estrogen protected against 5 cancers. And then when they added 3 more million participants and the study became the largest study ever run on human beings, it showed that it was statistically protective against breast cancer, lung cancer, and colorectal cancer, protective against neurodegenerative diseases, but it mattered how you took the hormones in. And it showed us so much of the benefit of hormone replacement, less AFib. In women who had AFib that went on estrogen, they started to have less AFib, less congestive heart failure, less acute cardiovascular events. They showed that women, high-risk cardiac patients who are told you can't be on hormones, right, because they're procoagulative, you're going to have a clot. They showed if you do hormones topically, that's not the case. In fact, they protect. And they cite 31 studies where older women with heart disease issues can be on hormones and often live a better life till they go on to the next incarnation, because we've been denying women these hormones. So that study shook the shoulders of orthodoxy. And now we are suddenly in a point where we know hormones do good, but we don't have any doctors that know how to do them good, so to speak. So much so that Halle Berry, who's a famous actress, we all know her, and she's very beautiful. And she went to a doctor in LA where you would think they have the best functional doctors in the world, but we're learning, alas, that functional docs are not as ubiquitous as we would think. And she went to some doctor who misdiagnosed her with Lyme disease and then misdiagnosed her partner with Lyme disease. And she went down a rabbit hole and ultimately realized that once she went on hormones, she's all better. She was really hormone deficient. Her emails had frozen. She had hormonal email freeze, and she needed a doctor that recognized it, that would reboot her hormonal computer. And once she got on hormones, she was back to herself, because that's one of the benefits of being on balanced hormones, is you feel like your younger, more vital self. And that's a lovely thing to do with having your present brain. I mean, that's a delicious combination. So she somehow went to Congress and got somehow interfaced with a bipartisan congressional session and raised them to put up a bill to raise $300 million from our taxpayer money to get professors that know hormones to teach them in med schools. But there are very few people that even know that. It's shocking, because we have such a bias that hormones are bad, they cause cancer, stay away from them, use them for the shortest. All these things are not accurate anymore. So recently, David Brownstein and I were so filled with angst that hormones are back, but there's nowhere to go to who knows how to do them. We put on a 16-hour continuing medical education course for MDs and nurse practitioners and whoever else might want to come. And it ended up being 7 countries represented, and way over 200 doctors, and it was a big success. It was called Everything Hormones, and it's still for sale for CMEs in the comfort of your own home online. I can give you that link if you want to share that with your people that are listening. But that's part of the frustration is everybody wants their email system to be working lubricatedly, but who do you go to get that done right and safely where you could just forget about your health and go on with your life and enjoy it?
Yeah. Yeah. And I love what you're pointing out here. They are vital to feeling well. They are vital to having yourself back, right? Because a lot of times you can just feel like, why am I forgetting words? Why? And these hormones are, when I worked in traditional medicine or gone to a traditional medicine or conventional medicine doctor to look into this, to get educated and see if I'd be a candidate, I was kind of screened for the top three symptoms. And that was it. Are you having hot flashes? Are you having night sweats? And sexual or vaginal dryness, right? Those were the three things. When we know that there's such a longer list of symptoms that you have when your hormones are waning. And so, like you're talking about, they're heart protective, they're brain protective. I had my motivation and my drive back. I had less anxiety when I got put on the progesterone, the right type of progesterone. So I love that you're mentioning all of this and that this new data is out there. And I really hope we put the dogma down about how hormones are bad, how they are unsafe, and really have practitioners, learning about this. So thank you for putting together that course. We will put the link in the show notes if anyone's interested in pursuing that, even just for their own knowledge, right? Not even just providers, but really just to educate yourself as a woman who really wants to know how her body works and what is recommended with the current data that you so graciously go over. Can we just double
You know,
click? Yeah.
it's just so crazy that hormones are so misunderstood. It's really one, it shows you how much medicine is run by trendiness and biases.
And
And
fear.
so, and fear. So you got
Mhm.
to figure out, well, who's the voices that I can really feel have their finger on the pulse, who will give me a sense of both sides, and where do I get this? So that's why these conversations, I think, are so critical. And I really appreciate being able to have them. Thank you.
Yes. Right. And I have to thank you because it was one of your articles that you put out. I'm on your newsletter. I follow you on Substack. And you were talking about the HOTUS article, the review article. And when I read that paper, it was
Uh,
undeniable about how women are underrepresented in, there's just more than hormones in that review article. It talked about other medications that it hasn't really been shown to be beneficial in women, but has been in men. And yet we are put on these same protocols. So enlightening to me, just reading
one
that
of the
one article.
biggest one of the biggest things that drives me crazy is in the Women's Health Initiative that we were just talking about. They did one of the biggest studies ever run on the benefits of statins in women 65 and older. They started with 190,000 women and they meticulously tracked them until their 90s to see who lived from 65 to 90 without a heart attack, without a stroke, and with mobility and ease, so they were somewhat enjoying their life.
Mhm.
And they found out that women with the highest bad cholesterol, LDL, they live the longest with the least heart attack, the least stroke, and the least joint pain. And older women do better with higher bad cholesterol. But the minute you get, and that's in the Women's Health Initiative, and it was published, I think, in Climacteric in 2022. I mean, it's in peer review, but nobody reads that article because it doesn't support pharmaceuticals. So many women are put on a medicine that actually, your eyeballs are made of cholesterol, your brain is made of cholesterol, and a lot of people start getting worsening of ophthalmologic issues and cognitive issues after they're on statins. But this knowledge is gold, and it is peer-reviewed knowledge, but it's not standard of care. And most of the time in most doctors' offices, you're listening to pharmaceutically benefited driven recommendations. And that's why it's important to hear other sides of the story.
Absolutely. And hear all the data, not just a portion of the data that's out there, and the narrative that was spun off from the trials that may or may not reflect pure accuracy. I
I
do.
mean, just one other thing. Sorry, I can't help myself here. The Women's Health Initiative had almost 12,000 women looking at joint pain, which is a huge issue as you get older.
Mhm.
And women on estrogen statistically had less joint pain, but we don't hear, if you have joint pain, try some hormone replacement. We're going to get put on pharmaceutical that usually eats up the lining of our gut. So
Yes.
yeah, yeah.
Yeah. Yeah. It's not the best medicine for sure. So I do want to go back and double click on, you were talking about the types of hormones that are used. So I do want to explore this. I was just had a conversation when I was coming back from we went to Cancun for Thanksgiving, and my daughter got sick on the airplane. So I, made friends with the person sitting next to her talking about what's going on. And turns out she's a nurse, and we talked about medications and being in the profession. And then we got around to menopause and how she said she's taking hormone replacement therapy. And I asked her what kind, and I'm a pharmacist. And so she talked about being on birth control as a modality to treat menopause. And she thought that was menopause replacement therapy. So I'd love to open this big box, and you can take it anywhere you want to go, but really why birth control is not considered menopause or hormone, and specifically not bioidentical hormone replacement therapy.
Great, great question. No woman, first of all, I don't think anybody should ever be on birth control, but I guess if you apply to med school and you get into Harvard and you have a boyfriend, you might want to consider it. You always risk versus benefit because it's difficult to figure out how not to get pregnant. But birth control pills are endocrine disruptors, but you should never take them for hormone replacement because birth control pills make blood thicker, they elevate blood pressure, and they're the number one cause of stroke in young women and in older women. So in perimenopause, a woman is much more vulnerable to stroke if she's low in her hormones. And then also, there's no study that doesn't show that birth control pills do anything but increase your risk of breast cancer. In fact, one of the driving issues, the elephant in the middle of the living room of why younger women now have more breast cancer, and younger cohorts means from 0 to 54 years old. And so we're even seeing stage 4 aggressive breast cancers in women in their 20s. And one of the biggest driving factors is birth control pills because ethinyl estradiol is the synthetic estrogen in birth control pills. And that's an endocrine disruptor that when I was a distinguished scholar at Tulane, it was one of the controls they used to figure out when they tested chemicals in the environment if they were endocrine disruptors. And then birth control also has synthetic progestins, which have been linked to everything from heart disease. We know this from the Oregon studies where rhesus monkeys who have progesterone deficiency have spasms of their major blood vessels. I mean, it really is progesterone insufficiency lays the groundwork for risk of stroke and things like that. And it's also very calming to the nervous system and helps the myelin coat all the nerves. It's phenomenal for the body, but in the form of progestin, that's a synthetic version, and that does the opposite of that. So hormone replacement should never be considered for menopausal hormone replacement. And honestly, if a provider recommends that to you, to me, that's grounds for walking out the door and finding another provider because this provider is not really knowledgeable in hormonal medicine. There's a best-selling book out right now by a medical doctor with 3 names in her name, and that's all I'm going to say about her name. All the women at the gym are talking about it. And in there, she clearly says birth control pills are exactly the same thing as menopause hormones. They're just in different dosages. And
Mhm.
just in Chicago, this September, North American Menopause Society, which is the major association along with ACOG over gynecologists, had their yearly meeting, and they basically still recommend synthetic hormones. And they say they're better because they're pharmaceutical. But the first 3 or 4 slides of the entire NAMS, North American Menopause Society meeting, were putting up all the big pharma names and saying, these are our allies. These are the people we shoulder with. They are completely supported by money from big pharma. So they're going to be supporting hormones made by big pharma. So then the doctors hear falsely, I believe, the efficacy and safety by their main association. They just listen to what their association says. They're pooped at the end of the day, understandably. It's not easy being a doctor. And they go home and want to be with their family and they don't dive into it deeper. And when you come in and ask that doctor which hormone is a hormone you should take, they say the standard old line, a hormone is a hormone is a hormone. But synthetic hormones are not the same thing as bioidentical, which are the exact same molecular shape of the hormones your body makes. Synthetic are slightly altered so they could be patented by a company that has shareholders, and that company, understandably, they're interested in profits with their stock, making money for their drug. And in many of the research out now, take a look at the University of Arizona neurology study that came out a few years ago. They looked at 400,000 insurance files on women and they looked to see who was on hormones, what kind of hormones, synthetic or natural, what were the dose, and who got Alzheimer's disease, who got Lewy body disease, Parkinson's disease, the neurodegenerative diseases that rob you of your life at the end of your life. And it was clear that women on hormones had almost 70% less risk of getting Alzheimer's disease. And you don't hear about hormones in gerontologic meetings bemoaning Alzheimer's. You only look at poor safety file meds that are very expensive, that cause brain bleeds getting approved by the FDA when we have these hormones, but they don't make a big pharma money. And the patient misses out. So the synthetic versions, synthetic progestin, and synthetic estrogen, they're metabolized differently. They look differently. Some women might be harmed. Other women might not be harmed. It's a bit of a roulette game because you don't know who's going to get the bullet out of the gun. That's why you need these big studies, because the human body never saw this molecule before. So we got to get away from a hormone is a hormone is a hormone. That's not true. And there's so much data on the potential damaging health effects of synthetic hormones, starting with birth control pill, starting actually with Pitocin in the birth room, but that's another conversation, to birth control pills, to then synthetic versions of hormone replacement, as men and women. Men are always offered bioidentical. Really, most women are mostly offered synthetic because most medicine sells its wares to women. We live longer, we're more health oriented, our husbands have to be lassoed to go into the doctor. We drive the money of the conveyor belt of medicine. And if we demand more bioidentical hormones and more education, if we say to our doctor, go take this everything hormone course, or invite these doctors to come give a symposium in your area to your doctors or your pharmacists, then we can start sharing this information. And if this information is kept on the down low, because it doesn't make money for the driving industries that are really part of the medical train at this moment. And women are missing out. So never get birth control pills for hormone replacement. Really consider changing a doctor that recommends it. If the doctor says you don't have a uterus, so you don't need progesterone, that's as old as the hills. Progesterone helps many, many other tissues, not just the uterus. I mean, there are ways you could call up a compounding pharmacist in your area and ask them who's the doctors that you get really great feedback from, and that, whatever you think you need, whatever specialty, or if you like someone with a great bedside manner, or whatever it is that makes you feel safer, you could say, this is what I like. Do you have any providers that seem to overlap with what I'm looking for? I think that's a great way, because it's very hard in today's medicine to figure out where to go about that. And And it makes such a difference in people's lives. And we're even now learning that most breast cancer patients shouldn't be denied hormones. Certainly, if you're triple negative, because you have no hormone receptors anyway. So the theory of hormones driving your cancer is mute, but all breast cancer patients are told they can't take hormones. And in that course, Everything Hormones, one of the bonus materials you get is I put together a P. Yeah. Did you want me to finish that sentence?
Yeah, go ahead.
I put together a PDF of there's 20, I can't remember if it's 26, it's 26 studies where they give women with estrogen positive breast cancer estrogen replacement anywhere from 1 to 3 years after they went through their treatment. And they have matched cohorts, meaning women with similar characteristics, similar tumor size, similar age. Some of the studies are 2 years long. One is 36 years long. One's 30 years long. One's 20 some years long. One was run by MD Anderson. Most of these studies were before the Women's Health Initiative. In not one of these studies did any breast cancer patient do worse. Women with ER positive breast cancer on estrogen had less recurrence, less death if they did have recurrence, which is extraordinary. In fact, the reevaluation of the Women's Health Initiative showed that women on estrogen, God forbid they got breast cancer, they had a decreased incidence of dying from it by 44%, almost 50% reduction in death. But no one talks about estrogen like that. We just vilify her to the heavens. So anyway, it's a new era, and you want a doctor that reflects that. So now we hope to train those people, but we hope to help you be trained to know how to ask the questions and where to go to get the best hormone support for you.
That's fantastic. Yeah, I took the training course with Donna White and learned about all the information about how estrogen is so protective. And I had to unlearn what I had learned in the past and really educate myself about the benefits. And I pulled some of those data, right, to really to look at and understand them. I want to just highlight what you had said because I think this is really important is that if you think you don't need progesterone if you don't have a uterus, right, to run the other way. I've cautioned some of my friends who have seen physicians in the area who have made that recommendation and said you don't need progesterone. But I think there's so much benefit to having progesterone on board. And do you want to chat more about why progesterone is so important as we age?
Sure. But you want to have little hints of who you want to see and who you don't want to see. And in my mind, a provider saying you only need, and I know that there's some providers that I really like, but they still say this is part of their teaching course or something. If you don't have a uterus, you don't need progesterone. In my mind, I would not want to go to a provider that has that world life viewpoint. Because so early on so England started giving women estrogen because they said we could keep you younger longer. And then in the 70s and 80s, we started to have these epidemics of uterine cancer. And it was because progesterone definitely protects the uterus from the growth aspects of estrogen, and growth out of control is cancer. And women taking only estrogen had a higher risk of uterine or endometrial cancer. So they began to combine estrogen with progesterone, but they used the synthetic progestin first. And once they realized progesterone added to estrogen did, in fact, stop this vulnerable increase in incidence of uterine cancer, that became the norm for women with a uterus. But if you don't have a uterus, you don't need it. But it didn't appreciate everything else that progesterone does. So progesterone is one of the highest concentrations of any hormone in the human body. And we're beginning to appreciate it's even in men, not just in women. And we used to think women, if they didn't go on to a pregnancy, made progesterone in the middle of the cycle, and the lack of that was PMS. And it was mainly the first 2 weeks before the period started where progesterone was robust. But we now know that progesterone is made all over the body to protect all of the body. It's made in the adrenal glands the first few weeks of the cycle. It's made from the corpus luteum the second. But in healthy younger to middle-aged humans, it's made in 6 parts of the brain to protect your brain and to help you sleep, which is why young people can sleep so well because their brain has so much progesterone. And a lot of the serious issues with insomnia as we age, this real horrific upside down relationship with sleep that's so restorative, in many people that can be regained by giving oral progesterone replacement before bed. And this includes men, not just women, because in the young human, the brain makes progesterone to protect your brain in many functions, but to also help you sleep. It keeps you calm. And just as so, the other issue that's happening with hormones is as we're learning their benefits, we now live in a planet that's cocooned with hormone assaulting pollutants. They're called endocrine disruptors. But we used to think they just disrupted estrogen, but they disrupt progesterone. So there's a lot of progesterone disruption, and they're called anti-progestins. So we have a lot of anxiety and reactivity and school shootings, and there's a lot of discussion. Is this because our hormones aren't working? Is this because even our empathy bonding hormone oxytocin is vulnerable to these endocrine disruptors? And the answer looks like it's yes, but progesterone helps heal. We use it in MS patients. We don't just take it for menopause. Knowing what a hormone's email does, we can give that hormone in a disease where the tissues are supposed to get the messages from those emails have gone wonky. So in MS, the disease is autoimmune disease is attacking its own myelin tissue, and progesterone helps regrow myelin. And there's no doubt about it. It does this, but most hematologists aren't going to, or, specialists aren't going to recommend it because hormones are not standard of care. And they're not a medicine that makes a lot of money for the doc and big pharma. And we give all of our MS patients lots and lots of hormones to help recreate a healthier terrain. But progesterone, we talk about leaky gut. That's in the vernacular. Your gut is the epicenter of your health. And if it's leaky, you get debris crossing your gut wall into your bloodstream, which is the basis of autoimmune disease and of just not feeling well. Well, progesterone, so to keep a gut from getting leaky, so the gates open and then close after a meal. So you eat, your gates between your single cells, your enterocytes open, and nutrition should get into your bloodstream, and then the gates should close. And if the gates don't close, a lot of debris inside the gut crosses over that shouldn't and makes your bloodstream murky and you feel murky. So you want those gates to have better staying power. And the staying power are these sticky proteins called adhesive proteins. And progesterone is the most powerful booster of a family of 44 of these adhesive proteins called occludins. So as you become progesterone insufficient and you're exposed to more chemicals and you're older and you're not ovulating because you make, progesterone also when you ovulate, but then your gut has a bigger tendency to be leaky. So we can even use progesterone not just as hormone replacement, but as an adjunctive therapy in people with gut issues, everywhere from inflammatory bowel disease to IBS to yada, 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 SIBO infections.
Mm-hmm.
So progesterone and estrogen and testosterone rule the immune system. And in COVID, we saw that women get COVID more, but die from it less. And men get COVID less, but die from it more. And that young women died from it even less. And older women on hormone replacement died from it less. And older women not on hormone replacement were the cohort, the group with similar characteristics because they were all older and they weren't on hormones. They died more from COVID. And when they did dives into it, they realized that hormones rule the immune system, which is why we get more we're vulnerable to immunodysregulation as we age. So in Mount Sinai, they did a pivotal study noticing that women's hormones seem to be really protective against COVID. So when
Mm.
men were in the ICU in this study run by Mount Sinai in New York, they gave two groups, one with standard of care and the other one standard of care with an intramuscular injection. They shot them in the muscle of progesterone, 200 milligrams twice a day to men. That's 400 milligrams, a big, pretty big wallop a day. And those men turned out to get out of the hospital several days earlier than the men who just had standard of care. They had less damage to the lungs because progesterone emails send messages to the lining of the lungs to heal from damage, to keep stronger, for the villi to move away debris stronger. So most people with pulmonary issues do really great when you add progesterone as an adjunctive protocol, if you know this physiology. So based on that study, they needed less antibiotics, they had less complications, and men did a lot better because progesterone protects the lungs. So, knowing where the receptors, the satellite dishes that receive the emails are, and knowing what the patient has, you can use hormones for perimenopause, menopause, andropause, specific issues. But now we're seeing that younger kids have less and less hormones. Young girls in their 14s, 15s having so little estrogen, they're having osteopenia. And
Mm.
functional MRIs show that the higher executive verbal areas of the brain that should be really big and dynamic in girls, they talk, 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 those were shrunk. And Harvard started out to do a 1 year trial with um, the neuroendocrine unit at General Mass because they had all these young girls that were having irregular periods. That's how you got into the study, is a regular period. They're either long, they're not the same amount every day, every month. You kind of spot sometimes you have cramps and heavy bleeding, you have irregular periods. Most of these ladies were heavy, heavy athletic women because that's big in our society, kind of all over the world. And many of these girls had eating disorders, body dysphoria, gender confusion, anxiety, insomnia. They actually had a lot of symptoms of perimenopause because it turned out when they looked at their blood, they were insufficient in estrogen and they were age 14
Mm.
to 24. So Harvard did a randomized trial, and the neuroendocrine unit of General Mass, they gave these young girls 14 to 24 birth, they gave some of them estrogen, progesterone, estrogen patches, and progesterone. Some of them they gave birth control. They had a wide variety because it was several centers that were involved. But they basically gave these girls 14 to 25 years old hormones. And then they had a matched cohort. So another group very similar to that group who didn't get the hormones, but they got placebo. So nobody knew who really had the hormones, but they could monitor their response. And the young girls on hormones, within a week or two, because hormones act fast, could sleep, had got rid of their anxiety, got rid of their gender confusion and body dysphoria, and just felt a whole lot better with self identity. And over a bit of time, the functional MRIs showed revolumization of the higher executive and verbal areas. And it was going to be a year study, but the girls didn't want to go off the hormones.
Hmm.
The study got extended to a year and a half, and it's published in a psychiatric journal because the hormones made young girls feel so much better and be so much more calm members of society, which right now we live in a very reactive, I think, hormonalist, email freezing up society.
Yeah, yeah, definitely very much anxious. There's that book that's very popular now called about the anxious generation.
Oh, I got to read that. I didn't hear that. Thank you. I'm glad to learn about a book I should read. Okay.
Well, thank you for that overview. Yeah, when we're talking about, I'm just reflecting about some of the things you've mentioned, like estrogen and progesterone, we have receptors all over the body, right? These are not just sex hormones. These are not just for hot flashes and vaginal dryness. These really elevate our brain, prevent heart disease. They're protective against cancer, like all of these benefits we're talking about, and even in the gut lining, and boosting our immune function. I mean, they're just so much more to hormone replacement therapy than just around these three symptoms that we have popularized back in the day. So I love the education that you're providing here. The last question, and if you have time, I would just like to just touch upon is we hear this concept that, be on them for the lowest dose for the shortest amount of time. And for a lot of docs that I've heard out there or through patients or through friends of mine, it's like once they hit 50, 60, 62, the docs are talking about taking them off hormone replacement therapy. And would you have any comments about what the research says about the staying power and how long to be on hormone replacement therapy?
That is such an important question. Thank you for bringing that up. There is this ignorance where women miss out that if take hormones at the lowest dose for the shortest period of time. That was the mantra. We developed these mantras in medicine. Om Mani Padme Hum. I mean, we have a mantra in medicine, the lowest dose for the shortest period of time. And that is not consistent with the majority of the data. And you have to understand how science unfolds. Usually there's a study on one side and a study on the other side. And what you're looking for is a trend and the heaviest weighted information, which we got in May of 2024 in the Menopause 10 million study, because women on estrogen for the longest period of time, older women had heart benefits, and they had 31 citations to support that. The Cache County studies, these studies got, so let me go back one second. The wrong Women's Health Initiative that turned the Titanic into the iceberg was published in July of 2002. It was because a doctor was successfully sued, Merck was successfully sued. The United States became paralyzed in fear that estrogen was a bad player. That was in July of 2002. In October, November, the Cache County dementia studies were first published. And this is in a county in Utah. Cache County is the name of a geographical area. They looked at a little under 3,000 people who did not have dementia, and they followed them into the future to see who got dementia and who didn't. And the women on estrogen for the longest period of time, 10 years, had a 50% reduction risk of getting Alzheimer's disease. If Dr. Oz was on TV and said you had a risk of reducing Alzheimer's by 50% and it's being sold at Walmart, we'd all go stampede over there and pull it all out. And unfortunately, it didn't get heard because it was so close in proximity to the bad news that the good news got eclipsed. And then a short time after that, the University of Arizona study came out and said you have almost a 79% reduction in getting Alzheimer's disease with hormones. And natural hormones work a little bit better than synthetic, but they said synthetic even worked, but the natural steroids were better, meaning bioidentical hormones. And it's just so I do not feel that the science supports the lowest dose. The other thing is your memories and your sense of self live in a very specific part of your brain. The piggy bank of your sense of self and memories is called your hypothalamus. And your hypothalamus shrinks in volume before every cognitive degenerative disease like Alzheimer's disease. But there is a God. It's like the liver. It can regenerate if you get it before it's been reduced to a raisinette, like in real end stage cognitive decline. And we know with brilliant scientists like Bredesen that you can reverse. He has a whole protocol for reversing Alzheimer's disease, and he starts with hormones. But the only study ever run so far, and I'd like to do the second study, was they looked at dosing. How much estrogen did you need, and how quickly did it volumize the hippocampus? And it can do it in 6 to 8 weeks to 2 months. It's fast, but it can't do it if you're already reduced to end stage, and you need a fair amount of estrogen on board to do it, not the lowest dose for the shortest period of time. So you really got to work with a doctor. We now know tracking numbers in certain blood work that shows you if you're really getting that hormone bang and revolumization of your hippocampus for your hormone buck. And I'm going to be 76 in 2 weeks. And
You look amazing.
thank you very much. And I'm running around the country lecturing all day on Saturday, about 9 hours, all science to doctors, and often another 6 hours on the following day, and running all over the stage and adding stand up comedy to third tier level science. And you couldn't do that without a brain that was well lubricated. And I had breast cancer 33 years ago, and I've been on hormone replacement for 30 years. So it turned out that the reason I had all these cancers, multiple cancers and things, even though I was living organically and forgiving people and detoxing, was my mother had been given while pregnant with me the model compound for the field of endocrine disruption. It came from a drug given to pregnant women. 38 million women were given this drug, and a lot of the daughters had cancers and had many, many issues. And this drug became the start of the endocrine disruption field. And I ended up being invited to be a distinguished hormone scholar with the scientists who unveiled this whole story at Tulane at an estrogen. I like to call it a think tank. It was called the Center for Bioenvironmental Research. So it's hormones are not understood by medicine today. And yet they rule the email. In fact, they don't even just deliver emails to receptors. We're now learning that all hormones have non-genomic signaling on cell membranes all over the body. Estrogen, progesterone, testosterone, they signal all cell membranes as well as hormone receptors. They truly rule the show, but the way our medical system has evolved, the physicians haven't been trained to evaluate all that to help women out. So if your doctor says, you're 60, you have to give up hormones, I do not believe in the estrogen window. We put many women on hormones in their 90s and got their osteoporosis normalized in 2 years and off many medications. I hate that estrogen window. I think it's extremely biased. And they often say, well, if you stay on hormones longer or you start them older, you have more dementia. But the majority of those studies are done with oral delivery of estrogen and or synthetic progestins. We see in the 10 million study, and we see in the Arizona study and the Cache County study, and even Esther studies in France that showed benefits of different delivery modes. We see that older women can be on hormones for a long time, and it keeps them younger longer. But what do you do when no doctors know this? And when you ask them, they're well-intentioned in their wrong answer. So now is the time for education and being honest, calling a hormonal spade, and having as many conversations like this as we can. And I will be giving a course for the general public, I think in January, on getting hormones straight. And it'll be on a summary of hormones and really seeing how estrogen docks and where these receptors and which cell membranes are involved, and all the way to the bases that you can chat with your provider about when you do decide how you would decide which way you want to take a hormone in. How do you get a good provider? I think I'm going to give maybe a 3 to 4 hour course on a Saturday in January to get our hormones straight and have these conversations. And the first so many hundred people that send in their questions will answer those questions on the course. So we've been thinking about this to try and help get the word out. And then on the same thing, Dr. Brownstein and I are thinking of doing another course in everything hormones in Florida and the Naples area. I just finished a 4-year contract working at David Perlmutter's old office in December of last year. So a lot of the pharmacists there would love to be part of it because we all became colleagues and friends. And Dr. Rabar, the iconic functional gastroenterologist, we're thinking he's 72, I'm going to be 76. We don't know when our expiration dates are up, and no one knows what he knows. And I do a lot of hormone protocols for inflammatory bowel disease, irritable bowel, and even Barrett's esophagus and esophageal issues. So we're going to put together a course for everything gut. I mean, it's teaching on the provider level, and then awareness for the woman, what's safe, what works, what might I consider, and how the heck do I pick somebody, an ally to work with? So I think that's going to be our aims in 2025 and 2026. And then I don't know what's going to happen with it, but Jen Simmons, who just launched, an ex breast cancer surgeon, she reached out to me a few weeks ago and just launched her book 2 weeks ago called The Smart Woman's Guide to Breast Cancer. And she's reached out to me to do a course for women as well as a course for doctors, everything breast cancer or high risk women. Do you really need to have a bilateral prophylactic mastectomy? 25% of mastectomies now done ever since 2013 when Angelina Jolie had hers based on having the BRCA1 gene. 25% of mastectomies are now done just to protect into the future because of the fear driven phenomena that's going on. So we need to talk about this. Can those ladies be on hormones? Do they need to avoid them all their life? What's the story? So education, education, conversation, conversation. If you want to go to my Substacks or whatever, we're trying to really get the records straight and wanting everybody to feel more at peace and have really high wellness IQ where you wake up and you love to face your day. And that's great health. And it really leans a lot on individualized, balanced hormone health.
Wow. Just wow. Dr. Berkson, thank you so much for all this education. We are about being epic here on this podcast. So loving the old, got to be epic wellness and just really wanting to live long and healthy and learn how to
Yes.
take care of ourselves. Please reach out. I'd love to keep my listeners and my audience informed of everything that you do. I'd be happy to send any links on of things that you're doing and keep them involved. Where can my listeners go to learn more about you and learn from you?
So you can go to my website, drlindseyberkson.com. Now, my first name's Daviki, and I'm threatening to go back to that, but my middle name is Lindsey. So it's under drlindseyberkson.com. And if you scroll down on that first page, you could see my memberships. I've got 3 levels: the Substack, the live where we meet once a month. And like last live, we went over all the different ways you could evaluate avoiding cancer, even what you can look at in your blood. It wasn't just like exercise more. We go more in depth. And tomorrow we're having another live meeting, and it's all about why was estrogen vilified and what are the reasons that we can see that she's not the enemy, and also who's Craig Jordan in this, which is a very special. So before tamoxifen, metastatic breast cancer kills you when it's metastatic. That means it's traveling through your body, metastases, distant travels of cancer cells. That's what gets you potentially. And at first, before tamoxifen was an anti-estrogen, which is a whole nother story, and we will be talking about that in tomorrow's live. Estrogen was used to treat breast cancer. 6 milligrams to 9 milligrams of estradiol were given to metastatic breast cancer patients fighting for their lives, and they had a fairly statistically significant remission rate. And then Craig Jordan put tamoxifen on the map, and he ended up being instrumental in some of my breast cancer treatment. We ended up talking together, and he gave me some guidance, and I actually reached out to talk to him again just recently, and he was my age, and I discovered that he just passed a few months ago. So most of my colleagues are passing or retiring, and I still have this fire in my belly. So you can go to my website, Dr. Lindsey Berkson. You can scroll down to my memberships. I also have a newsletter. Everybody should sign up for my free newsletter just to hear what I'm doing if you want. And you can watch me in my kayaking escapades. I started a women's kayaking club here, and we're pretty cardiorespiratory fit. And then there's also the links right on that first page. As you scroll down for everything hormones, you can even click and see what the out schedule for the class was and what the bonus materials were to help you make that decision if you want to get 16 CMEs for the end of the year in one fell swoop. And I lecture quite a bit. I've designed some products based on all this to clear off your receptors and make detox of receptors and detox not so difficult to do. So, right on my menu bar, you can click on my new products and you can click on how to use them. We're putting up a protocol for that in the next few days. And also, if you want to become a patient of mine, I only see very, very few people, and it's for an hour and a half plus the first visit. And you get this quite individualized notes after and guidances afterward. So if you wanted to do that, you could, there's a menu pull down for what's involved with seeing me and the cost of seeing me, and you could pay for it right there online. We don't do anything on the phone anymore. It's all by online. And we also have a list of the doctors that have who cared to be on the list, who graduated the course, got past their CMEs, and you could look and see if you're looking for a provider who took Dr. Brownstein's and my Everything Hormones course, because then you would know you have more of a player. Or I love to work with you and your doctor. A lot of doctors refer somebody to me and they'll be in on the first visit, maybe even the test result visit. And so it's always a learning scenario to pass this information forward. We need to pass this information forward so more women and men and even girls get safe, effective answers and stay healthy longer. When I was younger, I had multiple cancers and was continually ill. And now, in my older age, I have the youth I could not enjoy or achieve in my younger age, even though I was doing everything right. And a lot of that, people ask me everywhere I go, what do you do? And my foundation is the hormone replacement. And it's more, ever since the reanalysis in the last few years, I've gone to the highest level my body can handle, not the lowest dose for the shortest period of time. Once I did that, that was the titanic plate tectonic shift in my health. And now that I do that and recommend it in my patient's health. So don't be afeared of hormones, but you got to find a provider that's embraced them and lives healthy and balanced hormone medicine.
Dr. Berkson, thank you so much. So you just, I want to thank you for my health and my wellness and educating me in behalf of all the women that listen. I'm really fired up seeing you, seeing a healthy woman ahead of me, living her best life, kayaking. I love the photos that you include in your newsletters and on your Substack. So thank you so much for all that you're doing for the generations behind you and for pushing this information forward so more people can have access to it. Thank you so, so much.
I love a win-win. Gotta love a win-win. And everybody out there, may the hormonal force be with you.